So good afternoon, Dr. Keet. Thank you very much for your time today. And as you know, my name is Samit. I'm from KRSafe. I'm the founder and director of KRSafe. And today we're here just to have your views on the current healthcare challenges that we're having in the UK and the nationwide. So before we start, could you just explain or give a little background about you yourself?
Well, still in a few more years active service, dividing myself between the National Health Service in acute medicine and emergency medicine, which I love, and the genteel, quiet, niche concierge medicine of my private practice. I've been here 44 years, and I retired from full-time 25-year consultants, full-time consultancy in the NHS as a physician in general medicine and a consultant in geriatric medicine.
So when you're traveling to London or UK, anything you need on medical emergency, Dr. Keet is here to support all your primary care, and it's instant. You need not to wait too long, like whatever we have challenges in the NHS. So on that point, Dr. Keet, how do you think that the current waiting list we have in the NHS and everything, so be it an appointment, be it a blood test or MRI, people do really struggle.
Yes.
And so what do you think that the model what you're bringing in KRSafe, that bringing innovation to patient doorstep, and as you rightly said, everything under one roof. Yes. And that is exactly what I try to bring. You can get the doctor, I can take you to the patient house, or we can take the patient to you. You can get the blood test done same day. Even as MRI, we can take them to the nearby clinic, and the reports within 1 or 2 days, so 24 hours.
Yes, so we can navigate the patient very, very quickly and efficiently. And I must emphasize the point that we give the patient the time they need, so there's no sense of hurry.
Exactly.
Even in the private sector, unlike myself, a lot of 95% of doctors have to hire rooms, and to pay for the rooms they have to see one strict appointment system. But I clear the decks to make sure that any patient has all the time they need.
Similar thing in KRSafe also, to try to build you as a package. So you get everything covered up, so you need not to go to the next door for next thing. And that is what I think Dr. Keet mentioned.
Exactly.
So
yes.
Everything under one roof.
And also, as a generalist, geriatric medicine is actual general medicine in older people. So one has to know about all organ systems in depth, you see. And in the NHS, I do general medicine from the age of 18 in acute medicine. I do 8 to 12-hour shifts. So the point is that when I can deal with multi-organ system problems, and instead of the average person over 65 goes to a private specialist, really needs to go to about 3 or 4 to get a comprehensive assessment. Cardiologist, gastroenterologist, and several appointments in one.
Exactly.
So we can often do in one longer appointment
to cover every aspect.
Yes, and save them going to 5 other specialists, or even just down to the laboratory to have the bloods taken, unless it's one of your laboratories.
Absolutely.
So it's one-stop shop.
Yeah, and as Dr. Keet mentioned, like geriatric, older population is really that challenge where people are struggling to get the basic health and support they need. And that is why I think people like Dr. Keet, who has that vast experience and as a consultant in the NHS, and even in his private practice, he can bring everything together. So there is no multiple appointments or multiple coming and going, multiple location. So KRSafe and Dr. Keet will make sure that you get everything what is needed. And that is where we are coming into picture. And so if you're coming for UK for holidays, or if you're living in London, struggling to get that appointment for a doctor for your day-to-day or primary care support, please talk to Dr. Keet or talk to us. We'll make sure you get everything at your doorstep. So be it a consultation, be it blood test, even remote monitoring. That is what we are here. So we are not leaving you there. We have a smartwatch where we can talk in sometimes later detail on our smartwatch, WatchRx, where we can offer that remote medical monitoring. Even Dr. Keet can also see and feel the patient, and that is what we are bringing together.
So we'll give them a package of investigations leading up to, if they need intervention by a cardiologist such as stenting, or a gastroenterologist such as scoping, or a surgeon such as cutting. We can work them up to the point, often more than the specialist does themselves, before that interventionist starts.
So before we go, Dr. Keet, any final message you'd like to give it to our viewer that for due to the challenges, how they can come to you? So what is the booking process? How they get you booked?
Oh, my PA or myself, I would rely on you not to send me the appropriate patient. I resonate better
Absolutely.
with a certain type of patient in the private sector, yes. So I'm available 24/7, always take a call to reschedule and if necessary. I mean, and I must emphasize the comprehensive aspect of care, because who would start to do a jigsaw puzzle, for example, without wanting to complete it, yeah? And the commitment I have is to complete the jigsaw. There are no missing pieces.
Absolutely.
So
thank you very much for your time today. Thank you very much for being us.